things you do.
The main thing that they were doing in that was getting people ensconced in AA.
Really.
So that was sort of their main intervention. It wasn't a lot. I mean, they did do specific counseling.
Yeah, because I found there's like a whole 60-page, session by session therapy that goes along with it. Is that being used a lot?
There are places that use that.
A question for Dr. Christensen. I'm sorry, I didn't hear you. What did you say was the most common after bariatric surgery problem that you get, the most common question you get from people?
Oh, after they've had bariatric surgery, or the most common problem afterwards?
After bariatric surgery, I understood you to say there was one.
Oh no, the second most common reason I get asked to see somebody in the hospital is because they've had bariatric surgery.
Because what?
They've had bariatric surgery and now they have another addiction.
Oh, okay.
Yeah.
Okay. And that seems to be a common after.
Well, if you look at the number of people having bariatric surgery, it's much larger, but the bariatric surgery ward is about half full of people who have this complication. It's pretty dramatic. I know Brighton Hospital specializes in this for one thing.
Thank you.
If somebody's on long-term methadone or Suboxone treatment, do you see the same changes in the brain that you do in their system?
So I'm not familiar with the brain scan research, but it's known that all the things that were going wrong when you were using heroin, for example, would normalize when you start on methadone. So people, their hormones normalize, they get pregnant, they have regular cycles, their health returns. So if you're looking at the outcome, which is your health and everything else, yes. So,
Are there any reasons why antabuse would not work for some people the way it's supposed to?
well, antabuse works in one situation, which is called network therapy, which means that your spouse puts a gun to your head and says, swallow this or leave. And that's the plight. So we call it network therapy. But there's all kinds of ways around this. I know of a doctor who painted all his antabuse pills with nail polish. So he would take them every morning, but they would go through his GI tract entirely undigested, and he was drinking every day too. But network therapy claims to be
What if
effective.
they're actually taken, they're actually